Happening today, another stop on the vaccination site tour and an early start for Georgia's governor and the state's top doctor. In just 2 hours, the pair will be stopping by a Kroger vaccine clinic in Brookhaven. They just toured a drive-through vaccination site in Cobb County yesterday. The state is working hard to get more eligible Georgians vaccinated. Governor Kemp and Dr. Toomey announcing 2 new vaccine programs, one bringing vaccinations into hard-to-reach areas. Joe Ripley joining us live outside the state capitol to walk us through these new programs and what it all means for you.
You mentioned the first new program. Georgia set to roll out a second program aiming to help seniors, older Georgians, navigate that sometimes complicated and sometimes frustrating vaccine appointment scheduling. The vaccine process here in Georgia, 7 weeks in, still a work in progress, but health officials are hoping these 2 newest programs can get more shots into more Georgians' arms. 1 million Georgians vaccinated 7 weeks into the state's distribution program. So far, the state has administered about 2/3 of its vaccine supply. Health officials hope to ramp up those vaccination efforts.
Any additional vaccines are certainly welcome news, but we realize this will not significantly impact our overall lack of supply when it comes to meeting those demands.
Dr. Kathleen Toomey, commissioner of the Georgia Department of Public Health, says the state will roll out 2 new programs to add efficiency to the process. First, a program aiming to take vaccinations into hard-to-reach areas, parts of the state that might not have robust access to the internet, technology, and the most updated information. The other program will connect social workers with older people who aren't as tech savvy to help them get registered online. Dr. Toomey admitted the scheduling process to get a vaccine can be complicated and frustrating.
This is what I lose sleep over at night about, because I worry about those who aren't able to navigate the internet and able to manage what seems to be an impossible scheduling process.
She says these programs will help older Georgians and communities of color who might have hesitation to take them. Wary new variants of the virus could cause more concern, Toomey says. The state will work with aging agencies, local health departments, and the Department of Human Services to make for a smoother vaccine rollout, mobilizing every resource at hand. And the finer details still being worked out with these 2 new programs set to roll out in Georgia. By the way, a note here, Dr. Toomey says within the next couple of weeks, we should see a centralized hub where you can schedule those vaccine appointments on the state's public health website.
Joe, thank you. And here are 3 of the biggest local headlines related to vaccines. Up first, the state hitting a major milestone, getting shots into Georgians' arms. More than 1 million doses now administered, with half of those vaccinated 65 or older. Another 522,000 doses are still sitting on freezer shelves. At number 2, starting next week, Georgia will be getting more doses to disperse, going from 120,000 to 154,000. But the governor warns that even demand still far outweighs supply, and that the state simply cannot add any more Georgians to the eligibility list to be vaccinated right now. And at number 3, starting tomorrow, this is big, the Gwinnett County Health Department will open a mass vaccination clinic at the former Gwinnett Place Mall. There will be a smaller amount of vaccines given on Friday, and then on Saturday, a big launch of the clinic where more than 1,000 people will be vaccinated.
Finding places to get vaccinated across the country have been very difficult, and appointments filling up very fast. Of course, those phone lines, they're jammed. And now pediatricians say they want to step up and help administer shots to speed up the process of slowing the virus down. Liza Lucas joining us in the newsroom with why they say they need to be on the front lines of the vaccination process. Liza.
Fran, the American Academy of Pediatrics says that they are experts when it comes to giving vaccines. Think about it. They give these shots to little kids and teens and young adults all of the time. And that is why the American Academy of Pediatrics has issued guidance this week, basically saying that their members could play a vital role when it comes to expanding access to distribute the vaccine. In fact, Dr. Lee Beers, president of the Academy, says their doctors are eager to be part of the process.
We do this every single day in our office. We understand how to talk with families and adults about vaccines. We understand how to deliver vaccines. We understand the workflow. We understand how to ramp things up quickly so we can make sure that we're giving vaccines safely and effectively.
Now, as a result, the AAP is advocating for pediatricians' offices to be included in the possible list of locations where the public can go and get their shots. Now, as a reminder, clinical studies are still underway, so kids and young teens are not yet eligible for the vaccine. We'll keep you posted on that front, but the CDC previously did approve the Pfizer drug for those that are 16 and older, and the AAP has come out in their statement advocating for those teens that are those ages. Once they are eligible, they encourage them to also get the vaccine.
Liza, thank you. And there's a lot to keep track of when it comes to COVID-19. Of course, the testing sites, vaccination locations, and how to make an appointment. So we have information on those topics for you, 11alive.com, or just text the word vaccines. It's really simple, 404-885-7600. And of course, we'll send a link directly to your phone.